I'm Dr. Brad Bengtson, and you're watching the Plastic Surgery Channel.
Welcome to the Plastic Surgery News. I'm your host, Deanne Moore. Thank you for joining us today. In this week's report, we'll learn about the plastic surgery technique that the sultans and sheiks in the Middle East are lining up for, and take an inspiring look at our nation's fighting plastic surgeons. Plus, we'll check out a blossoming young star with some surprising opinions on cosmetic surgery. But first, the news. Remember that old movie, Logan's Run? In the flick, Michael York and Jenny Agutter are running for their lives through a futuristic city full of fantasy and danger. During their escape, they end up at the New You Salon, where a beautiful blonde introduces them to the Esculaptor Mark III, a laser gadget that can literally sculpt the client's face and body into any desired shape. Hijinks ensue. But what was once a prop in a cheesy sci-fi flick is now a reality, thanks to the brain boys up in the University of Michigan Cosmetic Dermatology and Laser Center. A new treatment based around an advanced surgical laser is making it possible to sculpt away the fine lines and unsightly spots of aging from the patient's face. It's called the fractionated carbon dioxide laser, and it's a new twist on laser cosmetic surgery technology. Ordinary surgical lasers use a single beam to make the tiny incisions involved in laser facial treatment. The new fractionated carbon dioxide laser uses several tiny, thinner beams that are focused on the area to be treated. As these microbeams hit the skin, they zap away tiny columns of scar tissue, sun-damaged cells, and other blemishes, leaving small invisible gaps in the patient's skin. And here's the neat part. Since these gaps are microscopic, the body's nearby cells consider them to be caused by ordinary wear and tear instead of by the trauma, and fills them in with collagen instead of scar tissue. And collagen is the substance that gives youthful skin its tautness and smoothness. That's the secret. The laser tricks the skin into filling in the portions removed by the laser with collagen, renewing itself. The procedure itself is brief and straightforward. The patient's skin is treated with an anesthetic, and the doctor makes two passes with the microbeams: a deep skin pass to erase skin lines and underlying scar tissue, and a pass over to the skin's top layer to even out the pigmentation and eliminate superficial marks. The redness goes away in about 2 weeks since there are no major incisions involved. Bleeding and the risk of infection are each minimized. So far, no complications or serious side effects have been reported. For those of you who don't trust their wrinkles to laser light, a group of scientists have stumbled over another innovative treatment option for aging skin. Fluorouracil is used to treat cancers of the colon, head, and other organs. It works by interrupting the copying process within the DNA of cancer cells, preventing them from dividing. Clinicians at the University of Michigan were studying the effect of fluorouracil on skin tumors of cancer patients when they noticed that areas treated with the drug had changed their appearance, and they decided to find out why. To this end, the drug was given in the form of a skin cream to 21 healthy volunteers with skin lesions and sun-damaged skin. Photos and biopsies of the treated areas were taken throughout the 6-month study period. The results: the number of skin lesions in the patients was significantly reduced, along with decreases in wrinkling, dark spots, darkly pigmented areas, and other areas with yellowed skin. It also stimulated the skin to produce procollagen proteins, the molecular building blocks of collagen. And since collagen is the main ingredient in healthy, undamaged skin, the drug had actually kick-started a process of self-repair, leading the patient's skin to repair itself. Could fluorouracil be the key to a true anti-aging cream? The researchers behind the study don't say so, but they do suggest that further research into the topical use of fluorouracil for cosmetic purposes may bear fruit. And while it is very important to note that Valeant Pharmaceuticals International, a big dermatological products company, supported the study, the editors of the June issue of the Archives of Dermatology vetted the results, so the study's data and conclusions are presumably completely legit. Coming after the break, find out how some Brits are scoring free plastic surgery and take a look at one of Hollywood's hottest up-and-comers as she escapes the reality TV bubble. But first, a quick break. We'll be right back.
You've invested a lot of time planning your plastic surgery procedure. You don't want to leave anything to chance. Now, there's an easy way to have peace of mind about your surgery. CosmetiSure. Every surgery has some risk of complication, but most health insurance policies won't cover complications arising from elective surgery. CosmetiSure is an affordable, short-term coverage designed to protect you from the financial impact of possible complications. CosmetiSure is only available through participating physicians. Before your surgery, ask your doctor about coverage with CosmetiSure so you can rest assured.